As you might know, the abnormal serum immunofixation patterns or oligoclonal bands is a well-known phenomenon in the world of myeloma, especially after transplant. It basically consists when you have a paraproteinemia in your, or a monoclonal band on your immunofixation that is different to the original isotype of the myeloma. So this has been seen in post-transplant setting and after some treatments, for example, with lenalidomide, and it has been historically associated with improved outcomes. We noticed a couple of our patients had similar phenomenon. We look at our cohort of roughly 45 patients treated with BCMA CAR-T. We actually noticed that this is a rather frequent occurrence. Roughly 23% of the patients had actually an ASIP at some point. It was transient in most of the cases, and interestingly, we noticed some difference in the terms of hypogammaglobulinemia in this patient. So those with ASIP actually had higher immunoglobulins compared to those without ASIP. Also, many of the times, there was a preceding immunological stimulus, such as a vaccination or an infectious event preceding the appearance of this ASIP. So I think it's a common phenomenon. I think the implications clinically for this, it's a little bit unclear, and it might not necessarily portray or be associated with the same benign prognosis as we see it in post-transplant, especially since this reappearance of the recovery of the hypogammaglobulinemia may be associated with loss of the therapeutic pressure of the CAR-T. So I think we need to look and do a little bit more of prospective follow-up on this cohort and try to increase our numbers.